to the upper part of the sternum, right in front of the trachea is thyroid gland is shaped like a butterfly. I'm kind of getting a little bit frustrated with what's going on here. Anyway, I think I'm either gonna ends with at this point, just not getting any good connection. Anyway, I think I'm either gonna ends at this point. Just all right, give me a minute here. Any good connection. Let's turn down this here because I have to monitor it by this. So yes, so I said the thyroid gland shapes like a butterfly. And what is the function of the thyroid gland? Well, it produces thyroid hormones. And the two main hormones that I am going to discuss tonight is T3 and T4. T3 stands for triiodothyroid. Hormones are produced by the thyroid gland. It's the hormone. It produces T gland to produce. Let me check. So it's almost 9 o'clock. I guess most people go into their bed. I don't know if I should go ahead and share live. Connection not even so wonderful here, so okay. So I said the anterior pituitary gland stimulates the thyroid gland to produce thyroid hormones. All right, so what's the purpose of the thyroid hormones? So thyroid hormones has many vital functions in the body. Among them is metabolism. It controls fast, we metabolize our food and so on. Controls body temperature, heart rate, our reflexes, our alertness, and so on. So it has many vital functions that it plays. And when our thyroid hormones are out of whack, all of these functions are affected in some way, some more than others. Okay? Now, let's talk about the signs and symptoms. Let's talk about hypothyroidism, the signs and symptoms. Now, hypothyroidism is mostly seen in the form of Hashimoto thyroidism. Okay? And the signs and symptoms are weight gain, intolerance to cold, slow metabolism, brain fogs, constipation, slow heart rate, eye problems. Usually they are dry and or it could be due to inflammation, but that's one of the signs. Dry skin. Sometimes there's tingling in the fingers, depression, tiredsomeness, fatigue. There's problems with menstruation in different parts of the body. Now, problems usually affects women more than men. Vast majority of times, it's women that it affects, but it can also affect men. And it's usually women in their middle age and older after menopause. That's when a lot of problems crops up. Now, someone who has hypothyroidism or Hashimoto hypothyroid problem usually is placed on medication, and there's a lot of medications on the market that the patient is given. For example, levothyroxine, that's one of them. But there is numerous other choices in the market. Now, there are certain foods you can eat. If you're a type of person who like, to try out other holistic methods, then there are a lot of foods that you can eat that has iodine content, because that's during the hormones. So foods such seafoods are good sources of iodine. Salmon, and of course we know that table salt has iodine added to it. Okay. Wild salmon, I think I mentioned that already. Bone broth, garlic, walnuts, blueberries, Brazil nuts, and coconut oil. So those are foods you can eat, just a small amount that I've given here, that you can eat to increase the levels of your iodine and so on. Talk a little bit now about hyperthyroidism. Now, hyperthyroidism, as you might surmise, is the opposite of hypothyroidism. And that's when you're producing too much thyroid hormones. So let's talk about the opposite of the ones that you see when someone has hypothyroidism. So instead of weight gain, person that has hyperthyroidism is going to lose weight. The person will be feeling hungry quite often. Increased blood pressure. Patient will experience diarrhea. Patient will have cardiac arrhythmia. The hair would be soft and silky, and the skin will be creamy and smooth. Personality changes. Person might have, some behavioral issues. Person will be hyperactive. Sometimes it is said that those people are wired. They just, all over, full of energy. And they might experience insomnia, a lot of sleepless nights. Okay? So those are a few. It's important to note that if you have hyperthyroidism, you should avoid ingesting aspirin, as that increases the level of thyroid hormones. Hypothyroidism. Well, there are some medications that are given to individuals who have hyperthyroidism. But there are other options. There are beta blockers, for example, that can be given. among other. Patient takes it, and over a period of time, the tablet gradually destroys the thyroid glands and prevent it from producing thyroid hormones. There is also surgery, thyroidectomy. The thyroid can be problems. They might only take out a part of the thyroid glands. It's important to note if someone has their thyroid gland removed, then they have to take calcium. It can affect how their body utilize calcium. So usually their doctor will instruct them on that. What else? So in both hypothyroidism and hyperthyroidism, the two main thyroid hormones are T4 and T3, okay, called TSI. And TSI stands for thyroid stimulating immunoglobulins. And the nodes on the thyroid glands usually produce this immunoglobulin that mimics TSH. So what it does is it stimulates the thyroid gland to produce an abundance of thyroid hormone. And that is mostly people who have hyperthyroidism, which is also called Graves' disease. Okay. The both conditions, both hyperthyroidism and hypothyroidism, are autoimmune diseases. So it's your body that is causing this havoc that leads to these conditions. Okay. Let me see. What else can we talk about? The diagnostic tests. So the laboratory performs a thyroid panel and that is used to help the clinician diagnose whether you have hyper or hypothyroidism. So TSH is done, that's part of the panel, and T3 and T4. And you can also do like free T3. There's a calculation they call T7 that is also done. And you can also do testing for TSI. Okay, so those are the main tests that is done to diagnose thyroid function. Also, in the case of where the patient is having Graves' disease, sometimes they develop goiter, a big mass can be seen at the throat. And they usually use CT scan of the thyroid gland and check. So that's also one of the diagnostic tests when a person have hyperthyroidism. Now, what else can I share with you? Okay, I think that's most of what I want to discuss. Thyroidism. Now, last week I did sickle cell disease, and I was not able to carry my live last week because, again, of the same problem I've been having. So now that I'm finished with hyperthyroidism and hypothyroidism, I'm just gonna catch up with a little bit of what I did last week in my videos on sickle cell disease. Okay, so first of all, let's talk about what is happening in sickle cell disease. Let's talk about the hemoglobin. So oxygen. And the way red blood cells carry oxygen inside the red blood cell, and that's how attaches to that complex, and that's how the blood gets oxygenated. So as 2 beta and 2 alpha. Those 2 beta and alpha chains also have a portion that surrounds it. Iron is embedded in the cell. So that's how, basically, in a nutshell, that is the composition of a normal red cell. Now let's talk a little bit more about a normal red cell. So a normal red cell lives for about 120 days in the blood. It circulates, go around, and carries oxygen and the iron in the blood and shape. So what I mean by that, it's disc shape. And it's the main carrier